Hello everyone, this is Ray, nurse practitioner who specializes in cardiology. And in this video, I just wanted to quickly introduce to you something called atrial fibrillation. It's one of the most common arrhythmias that we encounter in the cardiology field. And atrial fibrillation is basically when you have an irregular heartbeat that originates in the top chambers of the heart. We have 4 chambers in the heart, 2 top atriums and 2 bottom ventricles. And typically when the heart squeezes, pumps and squeezes, it's thump, 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 thump. Well, in atrial fibrillation, basically the top chambers of the heart, they're basically fibrillating. And so that's why they call it atrial fibrillation. And they're going typically around 300 times per minute. So it can be a dangerous arrhythmia in certain circumstances, especially as we get older. It increases your risk of having a stroke. So typically people come to the hospital complaining of chest pain, palpitations, dizziness, lightheadedness, things like that. So what we do in that situation, if it's the first time that we're seeing somebody with atrial fibrillation, we evaluate them, we take a look at what other medical conditions they have, and we see if we determine to see if they should be on a blood thinner to help prevent a stroke from the atrial fibrillation. Not everybody needs to be on a blood thinner that has atrial fibrillation. Depends on your age, your sex, and other risk factors, things like high blood pressure, if you've had a stroke before, if you've had diabetes, and some other things. So we use a little scoring system, and we would explain that to you if you ever came into the hospital with a new onset of atrial fibrillation. There are some other things that predispose you to getting atrial fibrillation, things like, again, uncontrolled high blood pressure, coronary artery disease, structural heart disease, things involving the valves in your heart. We have, valves that open and close and, allow blood flow to go in a forward direction in the heart. So these are all things that we would talk about when you come to the hospital and you're found to be in new onset of atrial fibrillation. So just wanted to give you a quick introduction to that. If you have any specific questions about atrial fibrillation, I'd be glad to try to answer them for you. So make sure to leave a comment. And thank you so much for everyone who has been sharing this content with other people, those who have subscribed. I really appreciate you. So don't forget to share this with someone that you know. And if you haven't subscribed yet, I would appreciate it if you did. It helps me grow the channel and push this content out to more people that are interested in this kind of stuff. Thank you so much for watching, and I'll see you in the next video. God bless you.